Well, as I said, we're now at a place. This is Kelly McAree's office. First time I've ever been in this place. It's comfortable. The furniture is well used. That's a good word. And Kelly's going to talk to us about the upcoming radiothon. But Kelly, thanks for opening up your office to us.
Oh, yeah, absolutely. I was thrilled to get the call, and always love talking to the fine folks at Shaw.
Oh, Greg's smiling over there, so it's great. Yeah, and we were very excited. Of course, everyone in Moose Jaw looks forward to the radiothon combined with CHEB and raising funds for the hospital. You've had such great successes over the years that it's something everybody. When is it? What's going on? And so tell us all about it.
Well, the radiothon. It's going into its 7th year, and time flies when you're having fun. When we started the radiothon, and one of board members at the time, Ken Hoxley, who still works on the radiothon with me, and Daryl Pizio over at the radio station, and we got together and we talked about this. Little did we know how the community was going to take it to heart. And in the past 6 radiothons, we've raised over $1.22 million for many different types of equipment. And the radiothon was the first radiothon in North America that raised funds for colorectal cancer, right? So, and we've raised for surgical area, we've raised for the children's ward, right? And that really started doing all the themed rooms in the children's hospital, yeah. And those rooms are going to carry over into the new hospital as well. But all that equipment that we have raised funds for, that's going to be transferred to the new hospital as well. And that is the focus of our 7th annual radiothon, and we're calling it The Future Is Now. And all the funds that we raise at this radiothon are going towards the new hospital's nursery, right? We figured it'd be a great way to start talking about the new hospital with the newest patients. Yes, exactly. And the number of births is approaching 600 births a year in Moose Jaw. Our population is growing, and we want to equip that new nursery and the labor and delivery services there with the absolute best equipment in Canada. So things for very, very sick babies, mm-hmm. Transport isolate, just in case they have to go to an ICU, right, in a different center. But we want to have that capability here in Moose Jaw to transport them safely. Everything from like panda beds, which are...
I don't know what a panda bed is.
Well, a panda bed is...
Black and white?
Well, they can be. They can be, but a panda bed is really a state-of-the-art piece of equipment that allows heat resuscitation if babies that need a little extra help, right? Healthcare workers have complete access to them, but all in this kind of micro environment, which is really, really ideal for babies that need that little extra little help. And so we're looking at bringing that, as well as really high-tech cribs, a birthing bed for the mom, vital signs and oxygen monitors to provide 24-hour monitoring of that baby, right, which is absolutely vital. And then, also one of the big parts of the new facility is really having a very comfortable area, right? So we're looking at kind of sleeper chairs / sofas. So, supportive family can really, have a place to relax and, help the mom and new baby out. So, it's lots of different, bit of high-tech equipment, bit of low-tech, but really providing a fantastic area and really supplying the nursery within the new hospital with just the best equipment to help those babies. So all the dollars that are raised are really going to go and going to be utilized in that new nursery to help our friends or family or relatives. And there's no better way to start than with new babies in our new hospital. So the future is now.
And of course, Regina has the high-tech neonatal unit there, but by having this upgraded equipment here, it will mean that there'll be less necessity to move babies from Moose Jaw to Regina. For we can deal with a lot more stuff here, and it's less stressful in the family and supportive and that kind of thing.
Absolutely. When we have better equipment and when we have better facilities, right, there's less need, right? But when that need is there, it's good to have the ability to do that. And all the dollars raised for through the Radiothon will stay in our community to help all those families at our new hospital.
Let's talk a bit about your partner in this event, and that's of course Golden West Radio. And so, what all do they have? What do they bring to the table?
They bring everything to the table. 800 CHAB and Golden West Radio are a community health partner of the foundation, and we really work closely with them. I've gotten to know Craig Hemingway and Rob Carney very, very well over the years, and everyone that works over there, and they're like family to us, and that's why we do call it the Family First Radiothon. They're constant advocates out in the community during the Radiothon, talking to a lot of their clients who want to raise funds. They're delivering posters. They're helping out the volunteers with all the phone teams. They're there for the entire 36 hours, and they're broadcasting, and I look forward to working with them every year. We have lots of laughs, but the one thing that I've definitely seen is how much that they take the Radiothon to heart. It's interesting. It's interesting that you mentioned that, because over the course of time, I've gotten to know so many of the people over there, but they utilize this facility. Every day, over 1,200 people pass through the front doors of this hospital. That's really significant. And many members of their staff, I know some of them have had babies here, or they've had sick kids, or they've had parents that are ill, or they've been ill themselves, and they've utilized the facilities here, right? So they take healthcare, just like everyone takes healthcare in this community very, very seriously. I find people that are outside of Regina or Saskatoon really have a special appreciation of their healthcare facility. And there's lots of passionate debate about the hospital in the community. And it is passionate, but that's because everyone has a stake in this new facility that's being built, and they want to see the absolute best equipment going into it. And, that's what the role of the foundation is really to equip it with the best equipment, best modern equipment in Canada. Because once we do that, it's easier to attract doctors, nurses, specialists, to have a state-of-the-art labor and delivery facility, have a state-of-the-art nursery, only does good things for our community, is really attractive for bringing in people. But you know what? When people walk into this new hospital, and I just came from another planning session for the new hospital, it will literally blow the doors off of people to see that type of facility in our community. It's just not a lot of architects, right, working on it. It's the amazing thing about the process of this hospital, and just taking a look at the work that's going into the pediatric area and the third floor of the hospital, and how it's connected to the labor and delivery area. It's nurses, doctors, patients, patient families, plus working along with the architect, the designer, the construction firm, the electrical company, the plumbing and heating company, all working together all at the same time to create a facility which is just it's never been done before like this. It's world class. Like, it is a world class facility being built in Moose Jaw. And for people, when they support the Radiothon, they are supporting something that's just not unique for Moose Jaw or Saskatchewan. It's going to be a unique facility in Canada, right? And that is so phenomenal, and it's once in a lifetime. Like, and I say that in full confidence. It's once in a lifetime for a community. Just for the concept for a person that comes in for like a basic day surgery procedure, right? With the old design of the hospital, right? The way it works is you come in, you check in at the front desk, right? You wait, and then you go to the lab and you get your lab work done, right? And so you get the lab work done, and then you might go over to X-ray. You might have an X-ray done, right, for the particular area that you're going to have, but you got to wait, right? You got to check in there. Then when that's done, you got to go up to the day surgery area and you check in there, right? You get that done, and then you go with the wait, and then they call you, and then you go back, you get gowned up, and then you wait, right? And then they call you, and then you go for your day surgery procedure, and once that's done, you go into recovery, right? And then you go home. The difference with the new hospital is you come, you check in, right? You go to your own private room. All the services are brought to you, right? And then you go for your day surgery, then you go back to your private room, and then you go home. That is incredible change for people, right? And until they actually go through and experience it, it's going to be quite different for them, right? But that same type of service is going to be supported in the labor and delivery area of our hospital, right? In the new nursery, right? And which is going to be great. So for the foundation to receive the amount of support in the community that we do, and to be able to bring this new equipment that's going to be utilized in that facility, it's a positive adding on to a positive adding on to a positive, right? And our partners, 800 CHAB, they work their fingers to the bone, and we're so excited with the 7th annual one coming up.
And it's going to be taking place up at the Town and Country Mall in the center court there on
May Thursday. It starts bright and early, 6 a.m. on Thursday, May 2nd. Hopefully there won't be any snow left. Yeah. And it ends at 6 p.m. on Friday, May 3rd. It goes for 36 hours all the way through. It is a thrill a minute, and we're so thankful to all the different service clubs, organizations, big business, small business, that come on board and staff the phones at all hours, and they do it with a smile, and they know they're doing something great for the community.
I love seeing city council there at 6 o'clock in the morning on Thursday. That's their shift.
Yeah, it is, and that's been tradition. Yes. That's started out, and I believe that started out with Dale McBain at the time, and to see those city councilors come out, and we joke around with that shift, but they enthusiastically come out and support. Our MPs, our MLAs, they come out. All the docs, all the nurses. One of the most inspiring things, though, is seeing the patients, and especially for this radiothon, moms bringing their babies right down, and it's just a wonderful feeling, right? To know that how much a person in the community, when they make a donation, can positively affect another person's life, right? And in Moose Jaw, everyone knows each other, right? It's the strength of our community, right? And just everyone knows each other, and that layer, that level of connection, it's really indescribable, right? and when it's so profound with healthcare, it makes an even more distinct difference.
Well, that's great, Kelly, and thank you for taking time out of your busy time here to come and for letting us come and talk to you. It's going to be a great time. A lot of good things happening. Make sure you check on your calendar, folks, and you can go on up to them all and you can watch them do their thing. You can contribute right there and become part of what has been a very essential part of our community in Moose Jaw of supporting the Radiothon for the Moose Jaw Health Foundation and CHAB. So that wraps up for now. Thanks for watching, and we'll see you again soon on Moose Jaw This Week.
The opinions expressed on the program you have just watched are not necessarily those of Shaw Cable Systems or of this station. Through our access policy, we provide the opportunity for community groups and individuals to express their points of view.